health warning for anyone with cavities. New details on the dangers that could be lurking inside of your fillings.
Plus, Michael Jackson
TV in flight.
Also, should you have your dentist replace those old silver fillings? The potential health risks from mercury coming up.
And tonight at 5.
Angeles. Now, Michelle Tuzzi, Mark Brown, and Dallas Raines as Eyewitness News continues.
The debate over mercury fillings just won't go away.
Dental experts say there's no reason to remove them unless you get a new cavity, but are they safe? Health specialist Denise Dodor has that.
The mercury filling debate claims science is on their side. Most dentists will tell you not to remove your silver fillings unless you have to. But what's the best way to get the job done? One local dentist has found a way to do it painlessly and effectively.
So the cavity is kind of sneaking in, and we want to make sure we get that cleaned off.
For 30 years, Laura Heights has had the silver filling, and now there's a new cavity. She's kind of glad because she's not too comfortable with the mercury.
It's not something I want sitting in my mouth. I'd like to get it taken out.
The only reason you'd remove a silver filling is if there's any corrosive layer or a decay that's being shown on the x-ray.
The FDA says you shouldn't remove silver fillings for aesthetics or because you're concerned about mercury.
The American Dental Association stands that the mercury level in fish and having silver fillings in your mouth are the same.
Yet, Laguna Hills dentist Dr. Payam Ataii says patients with silver fillings should know the mercury level can rise over time.
I had an independent lab run a tin lead mercury test for me. So that's what a silver
He compared Laura's 30-year-old mercury filling to a new one. Laura's old filling had less tin and lead than the new sample, and
the mercury level rose. The mercury level rose because as you're wearing down that silver filling, the mercury rises.
Dr. Ataii says removing mercury fillings can be tricky, especially if your dentist still uses a traditional drill.
Traditional drilling can do it. It's just a little more aggressive. Traditional drilling will remove healthy tissue as well as the bad tissue.
That's why he uses a diode laser. It removes all the corrosion and it seals the dent in as it goes along. Laura's cavity turned out to be much deeper than Dr. Ataii thought. He manages to save it. Without the laser, Laura was heading for a root canal.
99.9% it would have been a root canal.
This was Laura's tooth before. This is the corrosion found underneath the filling. This is how it looked after the laser cleaned out the decay. And this is the tooth restored. Laura says the procedure has a lot of advantages.
Now, while less dentists use amalgam fillings, it's still the preferred material of choice because it's less expensive and white fillings have a tendency to shrink. Dr. Ataii says a diode laser seals and preserves more of the tooth, making the kind of filling used less of an issue. So far, only a handful of California dentists are trained to use the laser. But many dentists I spoke to say that laser is probably going to be dentistry of the future.
Yeah. Well,